when smartphones came up with video calls, it was so nice to talk to your closer ones, overseas. But what if I say you can have your doctor's consultation with a video call, or over a phone you can have all your problems solved? That is what telemedicine speaks about. So I am also understanding what telemedicine is and bringing up the show on Info at 100. Let us together understand what telemedicine is.
ಕಂಟೆಂಟ್ ಇಷ್ಟ ಆದರೆ ಲೈಕ್, ಶೇರ್ ಅಂಡ್ ಸಬ್ಸ್ಕ್ರೈಬ್ ಮಾಡಿ.
Welcome to Info at 100. Today on my show we have two health experts. Today they're going to introduce telemedicine to our audience. So welcome to my show Dr. Uma Nambiyar madam.
Thank you.
And Uma Shankar sir.
Thank you.
Sir, for the audience to understand, what is telemedicine? Because we understand what medicine is, we understand what telephone is or conversations are. So how do you connect and how do you bring tele to medicine and how do you bring it to the public?
So telemedicine in a very simple language would be when the patient and the healthcare expert who's either treating or consulting with them are not in the same physical location. Now the best example which I can give you is what happened during COVID.
Okay.
Right? So during COVID there was total lockdown and nobody could go anywhere, but healthcare was happening. So people were consulting. So people at home were consulting doctors who were remote, either with the use of telephone or video consultation.
Okay.
And so this is just for consultation. Now there is a step further in this ecosystem. You also have devices. So people had devices, their saturations were being monitored.
Yes.
So you can also send these signals remotely.
Mm-hmm.
So with the advance in technology in telecommunications, if you merge that and use it for connecting remotely the patient and the healthcare provider, this whole ecosystem gets created, the telehealth ecosystem. And telemedicine as a consultative phenomena is part of this ecosystem.
So you mean to say you need not have a doctor in your physical presence?
Yes.
So even in absence of a medically trained person
In front of you.
You can have a consultation done.
Yes.
So what sort of diseases can be handled in telemedicine?
So if you don't need a direct intervention, as in I don't need surgery, I just need a consultation. That is what it is. A review of lab medicine, lab reports, ECGs, you can do that. Ultrasounds can also be done remotely, but in India, because of the PCPNDT regulation, we are not doing it, but otherwise it is possible to do.
Okay.
So imaging, teleradiology, teleophthalmology, telepathology.
Okay.
So I can do a pathology slide here, but I don't have a pathologist, but I have a technician who can prepares a slide and through technology can transmit it to a pathologist anywhere in the globe and can get a report. I could have one pathologist with me, but I want a neuropathology opinion. I can send this image to a neuropathologist. So digital scanning of the image, sending it out. So in this digital era, so this is all under the ambit of digital health. Okay, so and telemedicine, if you really see, I would call it as the building block of digital health, because the first level of data collection or the primary data collection from a patient, let's say an ASHA worker goes to somebody's house, collects the data and puts it in and sends it to a consultant. That's a primary level of data collection. So that's a building block on which you can build digital health, the entire system forward. So using the telecommunication technology to transfer voice, data or image for the purposes of healthcare is what you can use for telehealth.
So in a country like India, which is developing and where the technology is yet to reach parts of the country, do you think telemedicine will be successful?
So my dear, technology has reached most parts of this country.
Okay.
Because I think India has probably the population that has maximum number of smartphones in the world. Now every family member may not have one, but every family definitely has
one smartphone. Okay.
Why? Because during COVID, government was insisting on making sure that education and health is not stopped, and it was transmitted to people. The education, the schools are running on smartphones, so every family bought one, right? So although it is bought for the purposes of education, now they're using it for dadi's health and all of that stuff. So we do have technology which is there in remote parts. So healthcare needs to catch up in making sure that we can do the digital delivery of healthcare. So consultative is easier. Monitoring is the next phase. So there is lots of companies now who are in the field of remote monitoring and developing wireless remote monitoring. So that's the next phase. Third phase would be direct intervention using robotics. From surgeon is here and the patient is somewhere else in a remote space, and you can use robotics and technology and use telehealth for actual intervention. So it is done, but it is not very common at the moment. But the first two, what I was talking about, the consultation and monitoring,
It's happening.
is happening. It could be better. We could actually use it far more. But there are certain things which actually are a challenge at this moment as to why this is not popular. But popular during COVID because everyone is afraid they will die. And marne ki bari aati to we are ready to do anything. So, but now what is happening? So there are certain challenges that we need to overcome. One is I would say, although technology is there everywhere, the marriage of technology with health has to happen. And for that, there has to be a payment model.
Okay.
If a service has to be provided to a community, when you give it free, either there will be no person interested in delivering. The person who's receiving it will have no value for what he's receiving.
True.
Because it's free. So to ensure that there is a successful model, there has to be a mechanism of payment. So if you build in a financial mechanism or a financial equation for this transaction to happen successfully, that is something very important. To expect everybody to pay out of pocket is also unfair, so we need to make sure that the insurance companies take to it and categorize and segregate and figure out how different levels of consultation and delivery of health through the telemedicine or a telehealth system happen. They need to figure out how to make a payment for it. Second thing, what I feel is that there are certain privacy and confidentiality related issues when you do telecommunication, and also certain legal issues. Like say if I am consulting a patient now in healthcare system, every doctor can practice in their state where they are registered.
Okay.
Now through telemedicine I can consult in the globe.
Yes.
Now as a doctor, physically I can only consult here in Karnataka. If I have to go and consult in Kerala, I have to take a registration. Now using telemedicine, how that should happen, like if a doctor is not registered in the state. So government needs to tweak a few, I would say, guidelines and regulations for this to happen without somebody getting into a legal, trouble for all this. So this is another thing. Now most important, when I am sitting with you, we are able to have this conversation, you understand exactly what I'm saying, I understand exactly what you're saying. Now we are now sitting in another area, and you know how the phone connectivity is, how the video image transfer is. So network, the equipment that you have, and the way your connectivity and the bandwidth is all impact the conversation that we are having.
True.
Now you may have shown me a skin rash, and I may have not seen it very well because the video that you had on your phone was not good enough, and I possibly gave you a wrong treatment. Now who's responsible for this? So the legality of all this, and to make sure that if something goes wrong, who's liable? Is the doctor liable, the healthcare providing institution liable, is the telecommunication system liable, or the phone manufacturer liable, right? So there are a lot of these issues. So we need to make sure that we address all these and give a comfort to the physician as well as to the patient that within this domain or with these restrictions we can practice telemedicine. So these things have to come right for it to become popular and for people to be confident that okay, I can seek this consultation, it is legally valid, and for the physician to say that okay, I can give this consultation and I'm not going to be punished for a bad network in the patient's area, something like those things. So that is the challenges that we need to overcome in the country.
I heard that in India telemedicine has come all the way for 25 long years. So how far have we come and what is the future?
So we developed very slowly. ISRO started, multiple centers started. it was, different kind of hardware, different kind of, bandwidth. ISRO supported the entire program. It was slow, it had a slow and steady progress, and then it plateaued off. Some people fell off the grid for the same reason, that there was no money in it, there was too much time to be spent, and the takers didn't know what they were getting, all of that. And then COVID happened, and suddenly there was this whole upward graph, and overnight telemedicine practice guidelines were sent out by the government. So legally you could then do telemedicine. See, before that, people have been penalized for consulting on phone.
Okay.
1 year before COVID, in 2018, there's a gynecologist who was penalized for giving an advice on phone. Yeah, okay.
Okay.
By the court.
Okay.
So it was not allowed for you to do a consultation on phone. And then COVID happened, and we were consulting on phone left, right, and center. Okay, telemedicine practice guidelines came up overnight on the day lockdown happened.
Okay.
So now legally we are in the clear. We have people who have understood that it is not necessary to have this touch and feel thing for your doctor's consult to happen. Doctors are also quite okay mentally saying that, okay, I can see a patient at the remote. The healthcare organizations also are okay because it reduces the crowd in their outpatient space, gives them more freedom to get more patients who require acute care. So those spaces, segregation of spaces, all that is now understood well.
Okay.
What we need now is to make sure, like some of the legal and the financial aspects associated with the creating a robust ecosystem. You see, it's not as robust as it should be. 2 years of COVID, saw it happening, saw the scale, but it was not complete because some of these items that are required, especially the financial bit of the transaction, which is what sustains a business. So that to sustain, to have money should be generated within the system. You can't cross-subsidize telemedicine forever. So telemedicine, to become robust, to stand on its own, needs to have certain changes where societies like the Telemedicine Society of India, there are other digital health organizations, there is government, and then there is public. So all of them have to come together and converge to make this happen. I'm not saying that it will not happen. I'm very optimistic that this will happen because globally healthcare is getting to be more and more digital. Today everybody talks about AI in healthcare. Now AI cannot happen if you don't have data. And data collection at the basic level, as I told you, the building block data needs to come from the telehealth ecosystem, from the remotest of places, which people who cannot come to the hospital or where you cannot set up hospitals. So when that happens, so for that robust layer to be made for the digital health ecosystem to stand on, we need to create some changes. And I think that will happen. People have understood that this is required. So we just need to wait for the moment of convergence.
Because we are conveying the information to the audience, common man. As a common man, what changes do I have to bring it in me to accept telemedicine and understand that this is the mode of treatment?
So first thing is that you have to take it out of your mind that it is necessary for you to actually physically go to a hospital, to meet with a doctor, and in that 5 minutes get your entire advice. You should be able to connect with the hospital or the doctor online, take your consult and get your medication and be comfortable doing that. Not feeling it is less than what it would have been had I met this person physically. It's not necessary. So for many things it's not necessary. Now let us say there is a condition where you need surgery. Even there you need a consultation before. And instead of going to hundreds of places, you go to a town, then you go to one hospital, you're not happy with that, you go to another hospital, you go to look at the amount of money you're wasting, look at the amount of time you're wasting. Get it all done online. When it's as simple as grocery shopping, right? You do everything, you shop for everything online, shop for consultations online, shop for hospitals online, check which hospital gives you better service. Take an appointment and go, don't waste time. Don't have to wait outside. So you want admission, you you get your date and time of admission, you go there. So you don't waste time, you don't waste money. Once you understand that consultation and using telemedicine in healthcare is as simple as doing your online shopping or your online ticket booking, you will have changed. So it's a question of changing the mindset. And believe me, I mean, people have experienced it in COVID, and I think that mindset change is 9 out of 10.
But for a country like India, which has huge number of doctors, do you think we really need telemedicine?
My dear, we don't have huge number of doctors because we also have a huge population. So in terms of how many physicians we require per 1,000 people, we are still very less in that space. And many of our doctors, we go out. So a whole lot of Indian doctors actually are sitting outside in the Middle East and the Western countries because they are, so that is the thing. We have a lot of doctors, but most of them don't work in India. And the ones that work in India, we are not able to serve all our population. So one of the ways to address the issue of shortage of doctors is to see that I see more patients doing my online as well as seeing people in person. Because in person, the person sits with me for half an hour. Online, I can do the same consult in 10 minutes. Right, so even to utilize your doctors, the existing workforce in a more cost-efficient manner is probably to use online services as much as possible. So India is quite advanced in digital technologies and, as I said, in penetration of technology and telecom specifically. So when that happens, we should actually use that synergy between telecom and healthcare to make sure that we also address the issue of our manpower not going to the remote areas. You will not, find a neurosurgeon wanting to go to some remote area in a village. I mean, not required for one person to go. They'll have those kind of cases, maybe 2 in a whole year. But so to address common problems, to make sure that you can have the best care available even in the remotest of areas, use telecom, which is easy to reach.
I understand the consultations are happening on the whatever the media is used. But how was the prescription given and how was the medicines delivered to the place? How are these things happening?
So these things are actually there is a guideline, telemedicine practice guidelines, which prescribes how your e-prescription will be, how the medicines will be given, which medicines can be given through online services and which medicines you cannot. So there are prescribed guidelines. So as long as you work through that, and how is the consent mechanism taken? So if you want to consult with me through a remote system, I need to make sure that you are you and you need to make sure that I am me. So the identification of the patient, the identification of the doctor, how will this consult happen? How will it be stored as a conversation? How will the prescription be written by me and how will you get it? Is all prescribed in the telemedicine practice guidelines. So that's sorted.
Right. Yeah. So going ahead, Silicon City is all set to host a conference on telemedicine. So when is the conference and what are you looking forward to?
So this is our 21st International Conference of Telemedicine Society of India, which we call it as Telemedicon 2025. This will be held at the Indian Institute of Science Tata Auditorium, Jain Tata Auditorium. It's a 4 days conference which is starting from 27th of November till 30th of November. So we have various events part of this conference. 27th we have around 3 to 4 workshops we have a topic on space medicine and we have something on AI for healthcare professionals, how healthcare professionals can use AI prompting. Then we have a separate session for nurses, how nursing allied health professional can use AI. These are all workshops. Then we have any conference will have plenary sessions, keynote speaker sessions. Then we also have hackathon which is planned all over India. There are 10 hackathons happening all over India. Then we also have a startup pitch in digital health space.
Okay.
And we also have a expo, digital health expo, and an information center, where people can come and visit. Common person also can come and see what's happening in digital health and telemedicine. They can see what you were discussing with Dr. Uma Nambiar about what's happening. So everything live they can see and experience what is telemedicine. And they will get all information on telemedicine during those 3 days.
So hands-on experience will bring in
Hands-on
more
experience,
confidence.
confidence. Yeah. They can come and experience and see that. Then we also have digital health quiz for students, which they can participate in. There's a lot of learning, and it's going to be a place where a lot of information sharing. Everybody is going to come, from the highest government official to the students. Everybody will be there on this. We are creating an ecosystem where there's a lot of knowledge sharing which is going to happen.
Yeah. So just to add to what you were saying, most conferences, when it is a professional conference, you will only have a gathering of the professionals who speak the same language.
Yes.
This is the first time you will have public coming and seeing what the professionals do, because this is bridging the gap between the common public who needs to use these services and we as service providers, what we are going to do. And telemedicine is a medium that connects the patient to the doctor.
So is there any online, streaming of the program?
So yes, we will do online streaming, as well as what we want to do is invite public by invitation. So they will have to register as a guest, and we will do 100 people per day for 4 days, for them to just see what this is, for them just basic understanding.
So there are different levels. One is the public come and see what's happening, and for professionals we are taking them to exposure visit where the centers are functioning, so they get an exposure. And
how
one
many
unique
centers are functioning as of now?
The hospitals.
Hospitals.
Yeah. How many hospitals in Bangalore?
There are many hospitals are functioning, so the numbers exactly, it's very difficult. But we have selected the best for people to experience. For example, what is tele-ICU, then what is teleradiology. They can go on.
Tele-ICU also?
Tele-ICU.
Oh, yes.
Today there is a lot of things on tele-ICU. The intensivists may not be there. So one intensivist is managing 300 patients today live. So that's how the system is going on. Another unique thing what we have planned this year is we are making this conference a sustainable conference.
How?
So green conference. So everything is eco-friendly. So we are going to monitor the carbon footprint of each and every individual who is coming to our conference, and no wastage. It's a zero waste conference, and nothing is going to go to the landfill. So no plastics in anywhere, no water bottles, everything is reusable. Even the food waste, what is there, that is going to go in composting. So we are not sending anything to the landfill. So in that way, and we are going to monitor the carbon emissions. Except for a little bit on flight, even that also we have a guidelines. How do we reduce the carbon footprint? So we are calculating everything. And no petrol vehicles, we are also hiring only
All
EVs for that, and there won't be any single paper waste which is coming out. So it's completely a green conference or sustainability which we are.
The campus is already green. And
No, this is green by plants. But otherwise also, yes, campus is green and we do believe in sustainability.
because I see cycles only in the campus.
Yeah. No, but as a conference, I think we want to set a benchmark for conferences. Conferences usually see a lot of waste. It's all about, luxury and drama and all this stuff. We want to cut out all the frills. Conference for this, for what it is meant for, and making sure that all the frills that come, which are usually the waste, that we are going to reduce completely.
So the
So we're
conference,
seriously monitoring it.
conference theme itself is sustainability. Digital health for sustainable future.
Okay.
So we have combined sustainability and this together.
Yeah.
So, but you used a word, what is space medicine?
Space medicine, there are a lot of things. If you come to our conference, you will learn, and this is going to give you how we are going to use a space technology in treating patients. That is what we can do. One is a simple example. I can give you one example is when astronauts go there, their health can be monitored from here. That's one. And the other one, there are a lot of other things. Just I don't want to disclose everything here. Maybe if you come to our conference, you will learn, because there's a complete workshop on that.
Yeah. And we are partnered with the Institute of Aerospace Medicine to help us for this.
And
conference.
ISRO, both are.
And ISRO. ISRO, because that was the starting point of telemedicine in this country.
So this was our show on telemedicine. It was an eye-opener actually, I never knew that in the absence of a doctor, you can still be treated, you can have access to medical care from a remote place, and that is made so easier, and you have guidelines, government has given all these things. So this was eye-opener especially for me. So thank you so much for being on my show. That was Dr. Uma Nambiar ma'am and Dr. Uma Shankar sir. So All the best for your conference.
Thank you so much.
And,
And thank you for having us on your show.
Thank you.
Thank you. Just a last word, I request all to come and participate in the conference and get to know what is telemedicine and experience the telemedicine in India.
Any common man interested in registering to the conference, you have the number displayed on the screen, so anybody can get in touch anytime. This was Info at 100.